Although everyone in the world can agree that the eradication of malaria is a good thing, the challenge of eradication among malariologists is actually a controversial issue. I'm Brian Simpson, editor of Johns Hopkins Public Health magazine, and I'm talking today with Dr. Peter Agre, director of the Johns Hopkins Malaria Research Institute. Dr. Agre, thank you for talking with us today.
Thank you, Brian.
Why is eradication a controversial topic in the malaria community?
It's interesting that so much opinion gets injected in the term eradication. I think the controversy arises from, are we trying to do something that's impossible, for which we may fail? Eradication so that no one ever again gets malaria anywhere on the planet would be an ideal goal. Could we achieve that? In fact, malaria has been brought over control in the past, and oftentimes it's assumed that it's gone forever. But it has a way of returning. There's a dormant state, there are carrier states, and even if in an island, for example, like Sri Lanka, it appears to be eradicated, the parasite can come back from India, Bangladesh. So I think the controversy has to do more with the definition of what our goal is rather than what we really want to accomplish. Some have used the term, let's not promise to run before we can walk. I think if we could first bring it under control and eliminate it so there are no active cases, then we could start thinking more realistically about eradication.
So you don't come down in the eradication now camp, you take a more long-term view?
I'm not pessimistic. On the other hand, I try to be a realist, and I think the eradication issue was raised by Bill and Melinda Gates. These are the world's two of the world's wealthiest people who are putting a large amount of their personal fortune into this. And you would not expect them to come out with a battle cry, let's see if we can improve it by 5%. They'll have a bold kind of call to arms, and that's where I think eradication was used. On the other hand, this is a really wily problem, and I think committing to goals which may not be successful can actually have some negative consequences. People assume that, well, we failed and we'll fail again, and so why bother?
What would you say are some of the really critical requirements for the malaria endgame, such as would it be vaccines or what would you say?
Well, this is a very important issue because I think in part control and possible elimination from malaria can be achieved by improved methods of public health. Improved scientific understanding, the development of new medicines, and possibly, eventually a vaccine. That by itself can only be successful if the public health provision is adequate. We're at work in southern Africa. Right now we have large parts of Zambia where malaria is coming under control. In Zimbabwe, across the river, it's out of control. So it's clear that there's not a simple solution that's going to lead to the control everywhere. But I think providing good public health standards, and this of course has to do with good governance. And as much as we'd like to control the problem, nobody at the Bloomberg School of Public Health can guarantee what the elections will turn out to be in Zimbabwe. Mm-hmm. We're hopeful that democracy will prevail and orderly government will be available. And if that occurs, I think we can do tremendous accomplishments.
So the democracy and the infrastructure walk along together.
Yes, I think they very much travel together. When there's lawlessness, public health people just can't be out and about. On the other hand, I am optimistic. I think during my lifetime, world economic standards have improved dramatically.
And if you were a betting man, when would you say that the world would be free of malaria?
Well, this is almost a political question. If you ask any political candidate, he says, re-elect me and we'll take care of it. There's good reason to believe that many parts of sub-Saharan Africa within my lifetime can be brought free of malaria. It can be brought under control. That doesn't mean it would never come back if we all disappear. But I think the experience of Dr. Tuma and his colleagues in southern Zambia are pivotal in establishing that even in a exceedingly poor area, orderly public health and provision of good quality medical care can make a huge difference. So I would think in the next decade we should see remarkable progress. I would hope in my lifetime, which I'm hoping at least will be a couple more decades. I'm 62, I'm not 22. We could see entire nations brought free from malaria. We're starting with Zambia and Zimbabwe, but there's a lot of malaria in the Congo, and Kenya, and Uganda. So the challenge is huge.
Dr. Agre, thank you very much for sharing your insights on eradication and the future of malaria.
Well, thank you very much, and we're hard at work. We're having, I think, considerable success and feeling really excited about having the opportunity to pursue this important challenge.